Yeah, I'm Matt Dobson, co-lead of the TTS Research Guild. The Research Guild is a group of practitioners who work to support and promote research in TTS and with our partners across other agencies. Want to say a big thank you to the UXCOP and the DigitalGov University folks that have put a lot of work into getting this together and giving us this platform to share today, um, especially with Gene Fox of the UXCOP. I'm excited to introduce Amy Yoshida. Amy is a designer and researcher at 18F. She's a part of the Human Services Portfolio team. Amy put up a post in the MVB, which is a minimally viable blog for kind of a draft blog post about the work that she had done in Vermont and her team had done in Vermont and building research practice with their partners there. I said, I saw it, I said, I thought it looked fantastic. I thought it would make some good material for a Research Guild meeting. And upon scheduling that meeting, Gene with the UXCOP saw it and said, I think this would make a great webinar, introduced us to the DigitalGov folks, and now here we are. And to not say any more, I'd say here's Amy, and Amy, please take it away.
Awesome. Thank you so much, Matt. I am very excited to be here today. Let me make sure I'm sharing the right screen with you all. Can you see my screen? Awesome. Okay. So yeah, I am super excited to be here today. Like Matt said, my name is Amy Yoshida. I practice UX and service design as part of the human services team at 18F. And I've been doing design now for like 11 years, but I've been at 18F for the past year and a half. And most of the time that I've been at 18F, I've actually been working on one project, which is kind of an abnormal experience for 18F, but I've been working really closely with the state of Vermont, and I'm really excited to share some of the work that we've been doing with them. I am based out of Brooklyn, New York, and random facts that I like to throw in, I really love plants, and so if you like plants, good for you too, I guess. I don't know. Hi. I'm super excited to be here, so let's dive in. Today, we're going to talk about tactics that myself and my team used with the state of Vermont to help them build in-house research skills. We're going to talk about some top biases that research teams should watch out for and how we mitigated them in our work together. I'm going to share some resources that you all can use to apply to your own research practices, and there will be a bunch of links. This is going to go up on the webinar page shortly afterwards, so you'll be able to find it later. So hopefully all of this will be actionable information for you. So before we dive in, I'm going to set a little bit of context for people who may not be familiar with 18F. 18F is a civic consultancy for the US government, inside the US government. We are federal employees, and for those of you that may be more familiar with the design or research space, it's kind of like if you put IDEO or Frog or Pivotal inside the US government. So we work with government agencies, mostly on technology projects. And most of our partners are federal agencies, but we also work with state and local government agencies. And there's some rules that we have to follow when we do that. So most of our engagement with state and local governments look something like this. We can partner on discovery research and prototyping. We can help them do solicitations and evaluations of bids. So when they're buying software or a team to help them build software, we can help them acquire that. And we can help them with post-award management. So once they've chosen a team to work with or software to buy, we can help them make sure that it's meeting their users' needs. We are a little bit different than maybe some of the really big consultancies that you might be aware of, because our mission is really to enable our partners to continue working in user-centered ways after we leave. We really want them to be independent and to be able to continue the work without us. And so for me, as a designer and researcher, In an ideal world, this means that we are helping our partners build their own research practices. So a lot of my efforts with Vermont have been, thinking about product and all of these other design things. But one of the things I'm most proud of is what we're talking about today, which is the capacity to do user research in-house. So let's talk about this case study with Vermont IE&E. IE&E stands for Integrated Eligibility and Enrollment, and that's for healthcare and economic assistance programs. So over 200,000 Vermonters utilize economic and healthcare programs each year. These are programs like Medicaid, assistance paying for pharmacy, SNAP, which is food stamps, housing assistance, programs that really help people meet their basic needs. And these are challenges that are common in Vermont, but they're also common in pretty much every state. And this happens again and again. So applying for benefits often requires submitting the same information multiple times to multiple programs. It can be really hard to know what information is needed. Some of these systems are really old and they're based on paper processes that don't always make things easy for staff. And those things accumulate in errors and inaccuracies in data, which can result in delays in people actually receiving the services that they need. So this is kind of the problem space that we're operating in. And so as we try to understand how people interact with these systems, these are the things that are in the back of our minds. Vermont IE&E is working with 18F to do on a really high level, three things. One, develop a roadmap for modernizing their systems. Two, pair on specific pieces of that roadmap. And by pairing on specific pieces, we are hoping to develop in-house capacity so that they can continue doing the work without us. And today we're focusing on this very specific part, which is developing in-house research capacity. That's mainly because that's the part that I did. I want everyone to meet Molly. Molly is a real person. This isn't like a random UX persona picture. Molly has been really my research partner in Vermont. She is a Vermont state employee. Her official title is Outreach and Education Coordinator. To me, I said subtitle here. She's really been our main user research advocate and lead, who has gone from pairing with me to really leading a lot of the research efforts that IE&E is now doing. And she's done this by collaborating with a bunch of people, including 18F, business analysts in the state, coworkers who tag in as note takers, and across different projects or products, working with the different product owners or project managers. And we've worked with Molly to skill up as we've actually skilled up while we did the work together. So we conducted over 60 interviews with Vermonters, including customers, assisters, staff members, insurance carriers, community stakeholders, a lot of people about their experiences applying and paying for benefits. Molly ran some phone and email surveys that got responses from almost 1,200 customers, which is actually a huge amount if you're familiar with how hard some of these surveys are to run. We helped design surveys to collect baseline data from staff, so we understood what parts of the staff experience the changes might impact, and so we could understand in the future if we actually made the changes we wanted to make. And we did, at least I've been on this program this project working with Molly for just over a year. So that's actually an incredible amount of research and a lot of different things that we've done with Molly that I'm super proud of. And I want to share with you how we did it. So I'm going to share a bunch of things. All of these things are based on real life examples. I'm going to do my best to share as much information as I can. Feel free, if you have questions, to think about them, throw them in, and we'll come back to questions. So first off, we didn't start from scratch. I want to be really honest about that for agencies and organizations that are trying to start up research practices in-house. I have done a lot of research in my day, and so I came in and helped. But also, Vermont already had some talent in-house in Molly. Her title was not, user research specialist, but she was already comfortable talking to customers, being in front of customers, asking questions about the effectiveness of the ways that the state communicates with customers. So we already had some skills that we could build on top of. Molly just, what we were doing, we're introducing methods and giving her an opportunity to practice. So when you're thinking about starting a research, a research program, think about who you have on your team who already has some of these tendencies or these skill sets, and that will help you get moving faster. So things like comfort talking to users, the ability to act in a neutral role, perceptive and patient is a really important one. I'm not going to read all of these, but you don't have to have someone whose job title is user research to start doing research. All of our research efforts start with a research plan. And it's a templatized research plan. We're also not doing this from scratch. 18F has templatized a lot of research basics. And I literally just pulled the one that 18F has because it's great. And then we popped in information for the work that we were doing with Vermont. So I'm going to talk a lot about premium processing. And that is the way that people pay if they get subsidies on their insurance, just the way they pay their bill for their health insurance every month. But so this is just an example. There's a link above when these slides go out that you can go and like see this template. And so back to the research plan, there's some things to keep in mind when you're creating these plans. Make your research goals actionable. This is kind of a big thing that I'm going to harp on a lot. Research should help you do something. The goal of research should not just be to understand. We could get into probably some deep research debates on like whether or not we should use the word understand, but I believe that research should be really actionable and help you make progress. And so I'm going to give some examples of how we did that in Vermont when we were writing our research plans. Instead of saying our goal is to understand the differences in how people pay their insurance bills, we used describe how billing is experienced across different household types. So it's much more specific. Instead of understand if billing is different across insurance carriers, we used describe how billing is experienced across insurance carriers. And instead of understand where customers get confused, we used identify communications that are currently most confusing to customers. So at the end of all this research, we should know which communication materials we need to change and improve on in order to say we met this goal. Actionable goals, so doing all that work really helps you choose the right research methods. So for the goal of describing how billing is experienced across different household types, that when thinking about how we might learn that information, we thought that interviews would probably be the best way to understand that. And so, or one of the best ways to understand that. So that's our research method. The goal also informs our recruiting criteria. Different household types, okay, we need to ask about household sizes. We need to understand the ages of the people in the household. We need to understand their different types of coverage that they might have. And then it also helps inform the research, the actual interview questions. So when do you receive your bill? What do you do with it? What types of, or like what payment method do you prefer? So we can start to answer these questions. And you also we can use the goals to tie back to the most effective way to, the most effective output, the way to use to communicate our findings. So a journey map is a great way to describe how billing is experienced. Personas or behavioral archetypes might help us describe the different household types. And I'll give you some examples of what we came up with. So this is a very, very, very lightweight persona of one of the types of household, which is a mixed household. And in Vermont, that means that they might have different types of insurance in one household. So the parent might be on Blue Cross Blue Shield, and the child might be on, let's say the wife is on Blue Cross Blue Shield and the husband is on MVP. So they're mixed households. They have multiple carriers represented in one household. Another journey map. This, I'm not going to go into detail. I know the text is small. The point is, like, this journey map is the journey of a customer paying for their premium. So what is the experience of paying your bill, and where do people run into issues? So this map helped us to describe what that looks like and feels like for people. And the last example here is behavioral archetypes. So instead of personas, these are more motivated by, or more oriented around motivations, so actions and motivations. So the different ways that people approach paying for their bills. We've got really meticulous monthly auto payers, meticulous monthly payers that may pay by check and balance their checkbook all the time. They might track their payment in the mail. We heard that from people. Versus the folks who are low maintenance auto payers. They're set it and forget it people. And then a group here for people who actually wanted to maybe be an auto payer, but for whatever reason, we're not able to set that up. So they have created systems to work around that. So these are all tools that came out of that research goal that helped us actually make sure we were achieving that goal. And so before I move on to the bias, I do want to come back to just scaling the practice and some of these templates. Templatizing things allows you to not have to reinvent the wheel every time you do something, and can help especially if you have one researcher, it can help them get going a lot faster. So here are some other things you can create templates for, but 18F has created a lot of templates, and several of them are on GitHub. So please reuse the things that we've created if you would like. It is public domain, and hopefully will help you get going quickly. All right, so that's kind of some of the how we did work in Vermont from the really researchy methods side. I'm going to dive into more of the title of this webinar about bias. And so the second thing, in addition to reusing and diving in, we kept a really close eye out for bias. And I just want to stop and recognize that we all have biases. It's not something that any of us are immune from as humans. It's just a matter of managing the way that they impact our work, and we can mitigate it by just recognizing that we have them and then taking action. So I am going to talk specifically about two biases. There are many, many, many different cognitive biases out there. I included some references later in the presentation if you want to learn more about them, but for time's sake, we're going to talk about two that I personally think are really important for researchers to watch out for. And the first one is called survivorship bias. And my favorite quote about this is, when failure becomes invisible, the difference between failure and success may also become invisible. So I'll tell you the story about survivorship bias and why the heck there's a plane on your screen right now. So in 1941, the world's, or at least the US's best number crunchers were gathered together in Harlem. It was World War II, and their focus was, their charge for the time was keeping airplanes in the sky. And preventing airplanes from, or keeping more airplanes coming back from battles. So they were studying planes that had returned from battles to understand why planes were getting shot down and where they needed to add more armor. And they were looking at where were the most bullet holes and thinking that, oh, the most bullet holes are in these places. We should therefore add more armor because that is where they need to be reinforced. But statistician Abraham Wald looked at this and saw that the areas where there were holes were actually not where the planes were weakest. They were where the planes were strongest. The holes in a plane actually showed the places where a plane could be shot and still survive the flight home. So they actually didn't need to put reinforcements where there were bullet holes. They needed to put reinforcements where the bullet holes weren't. So the red dots on your screen are like the bullet holes, and the blue dots are where they actually needed to add more armor to get more planes home. And this comes up in our research all the time, and I will give you an example of where it came up in Vermont. We must fix the password reset kind of became an anthem. We heard over and over in our interviews that people were having an issue logging in to their online account so that they could apply or they could manage their benefits, and that it was just a really painful process for people to log in. And so the focus became on like, okay, we have to make it easier to reset your password. But we weren't asking the question of like, what about the people that weren't able to set up accounts in the first place? What about people that don't have email addresses? Like fixing the ability to reset your password isn't actually helping them get the benefits that they need. Doesn't mean that we shouldn't fix the password reset, but it means we need to understand who this this proposal is actually benefiting. And so I'm going to give you some ways. There's lots of other stories around how I've saw survivorship bias in my work with Vermont, and what we did about it. So first is opt-in lists can be pretty limited. Doing research in government is really hard. I just want to recognize that up front. It can be really hard to contact your users at all. So in no way am I saying don't use opt-in lists. What I am saying is that opt-in lists have limitations, and you should recognize that when you choose to use them. Vermont had a list of people that already had opted in from a survey that they had done in the past that had said, yeah, sure, you can contact me. We called that list and we talked to them and we learned a lot of valuable things, but we realized that the people on the list were more likely to have online accounts than the average, customer. They were more likely to pay their bills on time. They had mostly already resolved their problems. So these were all the planes that had come back from battle. They survived it. And we also realized after we thought about this that we might have more inclusive options. The state has an active customer list, and we were able to talk to their privacy office to see how we might utilize the different customer lists that the state had, or the different ways that the privacy office could help point us to limit survivorship bias in our research. The second way that we mitigated this was by meeting people where they are. So this is a really common phrase in research. We realized in our practice that people felt more comfortable in their own space. So we actually tried to meet people in a neutral place, like the public library, to talk about their experiences. And that felt really uncomfortable for them. But where we had much better results is when we called people and they could talk to us over the phone in the comfort of their own home about their experience, and it was their space. So that made a big difference. And the other piece is that we utilized district offices and community events for recruiting. So we went to the people instead of expecting them to come to us. And those spaces weren't great for having in-depth conversations, but they were great for building relationships and just starting to build trust so that people could say, yes, you can call me. And the last one, which I think is probably one of the biggest ways you can mitigate this, is by partnering with what I'm calling user advocates here. In Vermont, that means assisters and caseworkers, so people that actually help people access benefits. They are often, they work in hospitals or in community centers, but they're interacting with users all day, every day. And when it comes to human services, the actual people that use the services probably only apply for them maybe once a year. And so if we didn't catch them right when they were applying, they could tell us about their experience, but it might have been several months ago and their memory might be kind of foggy. But the people that are user advocates, the caseworkers, they might help people apply 4 times a day. And they see the places where people trip over things constantly, maybe even more so than the people who apply all by themselves. So they are super users, and we learned so much from them. The other piece to remember is that they might feel more comfortable engaging, especially if you are a government agency. There are lots of marginalized communities who have very good reasons not to want to interact with government more than they have to. And so working with caseworkers or authorized representatives in those cases helped us to understand the experiences of those communities without making additional asks of them. And the last place that I'll say we worked on mitigating this is when we were synthesizing our research into recommendations. I'm going to plug my computer in because my battery's getting low. So when we were synthesizing this, we, again, wanted to be really clear about who a recommendation serves. So when you come up with your findings at the end of like, we should change this thing about our product, or we should go in this direction next, I found it really helpful to be very explicit about, is this resolving a blocker for people who are not users yet, but may want to be? Is this resolving a blocker for existing users? Or is this an optimization that like isn't actually stopping anyone from doing anything, but it's like something that you should still do? And that actually helps you recognize, oh, all of my recommendations are only helping existing users. What about the people who are having a hard time accessing these services in the first place? And the second bias that I want to talk about is called the framing effect. So this is a really good example of the framing effect, and that's, we'll say you can see on the screen there are 2 frozen yogurt tubs that have labels. One of the labels says contains 20% fat, and the other label says this is 80% fat-free. It's exactly the same information, but people will over and over again go for the 80% fat-free because of the way that the information is framed. And this is really important when we're doing research because we accidentally frame, or another word for this is prime, our users, and it can impact the information that they share with us or the way they share information with us. So George Lakoff wrote a lot about this, and in one of his lectures, he put this into his presentation where he told his students, and I'm doing it to you right now, don't think of an elephant. So try your best for the rest of this time to not think of an elephant, but I bet that you will be thinking of an elephant, and that's what we do to our research participants all the time. I'm gonna give you some examples. So when we're introducing our studies to users, we might say, we're trying to understand how hard paying your bill is. And that is framing paying your bill as hard already. And so people are going to tell you about how hard it is, and maybe they don't actually think it's that hard. Instead of saying that, you could say, we're looking to learn about your experience paying bills. It's neutral, and it gives them the ability to add in the adjectives instead of you. When you're writing your interview questions, instead of saying, how easy is it for you to read the notice? Well, if I'm your research participant, suddenly I think that I'm dumb if it wasn't easy for me to read the notice. So I might not give you an honest answer. And it's very much a leading question, because if I say it was easy, as a researcher, I might say, okay, I don't need to fix that. So instead of that, ask, tell me about your experience reading this notice. What information were you looking for? How were you able to find, like, were you able to find it? And if you were, if you weren't, like, how did you go about doing that? And that will give us a lot more information about how that person interacted with the notice. Next is when you are debriefing with your team. And this I see all the time. We put a debrief question in that says, what was interesting or surprising? And that implies that it was interesting or surprising to you, the research team. Well, our research teams are biased because we're humans, and it actually doesn't matter that much what was interesting or surprising to us, because we're working on specific research goals. So rewind, if we made actionable goals in our research plan, we can use those to inform our debrief guides. So we can ask questions like, how did this interview help us describe how people, how different households pay their bills? And then the whole conversation can actually be about the research and the activity, and not about me and my own biases. And last but not least, when we're synthesizing your research, synthesizing based on recall, so is again just another version of what surprised you. It's the things that stand out in your memory, and I've see people do this a lot instead of actually using the notes and the transcripts from the session. So you can mitigate this by generating post-it notes directly from your notes. And that helps avoid skewing your data and your synthesis. So the third piece of how we did all this work, as we found resources and we created resources. We learned as we went. I gathered some of these here in this research party slide. You will have access to this later, so I'm not going to read them all to you, but I gathered some for learning about biases and mitigating them, and some about the research methods that we used and building your research team. So in recap, we talked about tactics, we talked about some top biases, and I just showed you the research party. Hopefully this presentation will also be a resource for you. If you take one thing from this presentation, remember, don't think of an elephant. Thank you. All right, so we have time for questions. It's 2:34, and I think we have a bunch of time. So I would love to know what questions you all have.
Hey, Amy, we've got a good one. First of all, great job. We've got a good one. How is the framing effect different from asking leading questions, or is the framing effect a subset of leading questions?
That's a great question. It's not really that different. It's just like giving a fancy name for it. Like, it's like what happens when you ask leading questions. So same thing, kind of.
And another one, it says, Amy, can you say more about why it's discouraged to discuss our reactions, what's surprising, etc.?
Yeah. So I will use myself as an example. I don't think that it's bad to talk about your own reactions. It's just bad when people only talk about their own reactions. So when like growing up, I was like in a household that did not use these services that I'm working on right now. And I recognize that that is my experience. So when I talk to people who depend on these services, there's going to be things that stick out in those conversations that are surprising to me because they were different from my experience. And if I use all of my debrief time to talk about how that was surprising to me, then that's great because it means I'm becoming more like aware of my own biases, but it doesn't actually help us answer our research questions. And it's centering the whole conversation on myself instead of the experience of the participant. So it's not a bad thing to reflect on your experiences, to talk about that with your team. It just shouldn't be the only thing you talk about.
And Amy, you talked about getting from your notes into post-its or the tools you're using for analysis and synthesis. How do you, going further upstream a little bit, how do you avoid introducing bias into those notes?
That's a great question. So avoiding introducing bias into notes. So I really favor, there's lots of different opinions about this. I favor verbatim notes. I am biased toward them because I can take them. I recognize they are a really, really tricky way to take notes. But I have found that that's kind of the best way to just focus on what the participant is saying and not my own interpretation of what they're saying. I don't focus on spelling. You can abbreviate the heck out of them, but I focus on capturing what the person is saying or doing. And I really try hard not to let any of my own interpretation slip into the notes. Interpretation is for like synthesis and things later, not for note taking. So to whatever degree you can focus on what is happening in your notes, that'll help decrease the bias that is in them.
Great. We've got another one here. Do you have any tactics for conducting debriefs without relying solely on recall when they're generally so soon after a set of sessions that it's hard to go over all the transcripts, and especially so far team members who are, especially so for team members that aren't researchers?
Yeah. So I one like to give people a break right after a session. Because I found that going straight into debrief can be jarring. Um, but I think really thinking about the questions in your debrief guide and being intentional about what those questions are, and just I really just pull them directly from the research goals. And the goal of debrief with the team is exactly that. It's debrief. It's not to like remember everything exactly as it happened. But if you use your research goals to guide your debrief, then that should help focus on actually answering the questions, and then give your team time to actually go through the notes in detail, not when everyone's together debriefing. I hope that makes sense.
So, I mean, a lot of times I know that research is really it's a team sport, and it's a thing that we do in pairs. When you're talking about supporting somebody like Molly, is that the name your person that you helped?
Yeah,
Like,
Molly.
so with someone like that, when you've only got one person, how do you make the most of it when an agency can only support one person in that sort of research role?
Mm-hmm. I think this is very much the reality for a lot of agencies where, especially where when user research is a new concept, it's hard to dedicate multiple resources to something that an agency doesn't fully understand yet. And so if there is one person that like you can free up some capacity for, that really has some of those traits that I had mentioned earlier. You know, they're already comfortable talking to customers. They are comfortable listening before adding their own thoughts to it. And so one, look for people that are already kind of ready to be to be in the research seat, no matter what their title is. And then two, again, it's totally a team sport. So you can pull different people in for note takers, for observers. You can give people different jobs. Sometimes, if you don't have a super strong note taker, having multiple note takers is a great way to help balance that out. And those people only have to make like an hour commitment to help you during a session, rather than 20% or 70% of their day job, right? So finding ways that you can collaborate with people, bring them into the research without making it a huge part of or a really big ask is a great way to expand the capability of a small one-person research team. Is just being, I don't want to say creative, that's not specific enough, but figuring out ways that you can tap the skills of your teammates. And the other point is the smaller the team, the easier it is to get lazy on sharing and documentation. But the more important it actually is to focus on sharing and documentation, because nobody knows what's in your head except for you unless you get it out. And so if it's a small team, really being your own spokesperson and your own research spokesperson becomes extra important. So making sure you're putting findings into slides, into reports, into anything that is actionable that people are looking at, get those research insights into them and make sure it's documented. Yeah.
Thank you. That's really great advice. There's a kind of a follow-up to the conversation about debriefing. Is how do the results from a debrief and the results from your synthesis relate to one another?
Great question. So when I do synthesis, I tend to kind of ignore the debrief, to be completely honest. Like, I use debriefs as a way to just quickly process the information that is happening in my head and make sure I capture things that seem really important that I, might lose. And then I do my synthesis and I kind of start from scratch. I don't like go to my debrief notes before I do my synthesis. I might go back to them afterwards to see like, oh, after I actually had time to think through this and to look at the notes and to pull out insights from the notes, I might go back to my debrief and say like, and try to re-answer the questions, or see if my answers changed between when I left the session and after I did synthesis. But I actually explicitly try not to tie them together while I'm in the process.
One more in the chat that says, do you recommend formal training in facilitation?
Yes, but I recommend practice more. I almost had a slide in here for this actually, but I took it out because I didn't want to talk everyone's ear off. I think practice is kind of the most important thing in becoming comfortable with doing any of this. And one thing that I did with Molly when we were first starting out, before we did any interviews, is actually Aditi helped me with this. So we have put together our first interview guide, and then I created a profile of a fictitious but very realistic Vermonter that utilizes these services based off of real data, but fictitious person. And I had Aditi actually answer the questions. We did a mock interview, and Molly facilitated the interview, and we practiced what that felt like to ask a user questions and to wait for them to respond and to ask follow-up questions. And Aditi gave her feedback at the end. And you can do that with your teammates. I would practice. You can do it with questions that aren't related to the thing you're researching, if that's an easy way to get into it. I would recommend practicing the way you hope to play the game. So with like realistic data once you feel comfortable doing that. But practice over formal training is probably where I go. Not to say that formal training isn't super helpful. It totally is. Practice is something you can do every day.
Amy, that's really, really great. I wonder if there's any more questions from the chat. Maybe give a second or two for those things to bubble up and see where we go.
Awesome. Stop sharing my screen.
You're that big crowd. Oh, here you go. What do you do when you recognize that some bias has been maybe inevitably introduced?
Right. Yeah, that's always going to happen. So bias is unavoidable. So this is a really I'll use an anecdote. So when the opt-in list that I mentioned in the presentation is a great example of this. Vermont had a list of customers that had said, yeah, sure, you can contact me for research or something at some point. And we found that and thought that it was a great place to get started talking to users, and it absolutely was. But as we started talking to those users, we realized that, or the people on that list, we realized that, they had already solved their problem. Like, the reason why they felt good about being contacted again was because they were happy with the result of their initial contact. So we realized that our results were going to be biased towards people who had already solved their problems. That didn't mean that all the data that we collected from those interviews was useless. It was actually super useful, but that meant that we needed to mitigate the impact and balance out the impact of that data. So we needed to find people who hadn't already solved their problem, and so that's where we ended up getting talking to the privacy office to see how we could utilize other lists of people, going to district offices and catching people who are like actually in the process of trying to resolve problems. And so yeah, I think if you realize, oh no, we created bias in our data, that's totally fine. It's actually great that you noticed it. And now your next step is to just figure out how you can balance the impact.
Awesome, thank you. I think that's puts us about 10 minutes to the hour. This has been fantastic. Thanks again for stepping up and turning this blog post into this really great talk. Yeah, and thanks to the DigitalGov University folks too.
Yeah. Matt, if it's okay, I did want to mention another question I saw come up in a couple ways regarding debriefs. So one person had said, is it necessary to debrief? And then someone said, later, if you don't reference the debrief notes later, then what would you say is the value of the debrief?
Yeah. If so, first, is it necessary to debrief? I think that I don't want to say like yes or no because it feels really extreme. I find debriefs really helpful for the team that was either in the session or paying close attention to the session, to be able to like kind of switch out of researcher mode. Because it's sometimes you have a really intense conversation with someone. The interview is really intense and your team just needs to talk about that, and otherwise everyone kind of if you just switch into doing something else, everyone feels really anxious, like there's loose threads hanging out. And so I view debriefs as a way to kind of be really intentional about the experience of your research team. And I will add that doing debriefs with your participants is also a really good idea, something that I'm trying to incorporate into my practice, because sometimes we have really intense conversations with people and then we say, hey, thanks so much for sharing all this intense stuff with me, bye. And then we don't like actually intentionally wrap up that experience for them. So I think it's, for me, debriefs are less about the data and more about really understanding the needs of like humans that are involved in the research process. I hope that, did that answer both of those? Okay.
Let's see. I mean, it seems like it did. Yeah. People
Cool.
are saying yes. Great. Yeah. And yeah, the DGU hosts have shared our emails. So please feel free to contact any of us. Amy, you know, about her wonderful presentation and the work she's been doing. And then as far as the Research Guild at TTS, you can direct questions to either Matt or myself or both of us. Yeah.
Awesome. Thanks everyone for coming and listening to me talk.